Good afternoon. My name is Olivia Galloway Sanders. I currently attend Herzing University, where I am obtaining my MSN with a concentration in F&P. I will be discussing a program plan presentation based on the community of Fairburn, Georgia. This PowerPoint will cover the introduction, the definition of the community, windshield survey, community assessment data generation, community partners and resources, develop community health diagnosis, devise community health plan, propose interventions for community health plan, propose evaluation methods for community health plan, summary, and references. Introduction. The community of Fairburn, Georgia. The purpose of this PowerPoint is to provide a brief overview of a previously completed windshield survey and community assessment of Fairburn, as well as to identify an appropriate and timely community-wide intervention that can improve the health of its residents. Other key points that will be elaborated within the PowerPoint is a formal definition of community and a description concerning how this definition has changed in recent years. Is followed by a recapitulation of the windshield survey and community assessment results. In addition, a description of the intervention activities and the resources needed to achieve the objectives and accomplish the goal of the intervention is followed by a proposed evaluation methodology that will be used to measure how effectively the stated goal was achieved. Definition of community. Legal definition, revised extended definition. There have been some changes to the definition of community in recent years. For instance, the legal definition provided by Black Law's Dictionary states that a community is a neighborhood with people who reside in more or less proximity, a body of people living in the same place under the same laws and regulations, who have common rights, privileges, or interests. More recently, however, the definition has been extended to include the concept of choice. In this regard, Garber reports that community is not merely something that one fits into, it is also something one chooses for oneself through a process of self-discovery. It is based on shared circumstances, and it is active rather than passive. Windshield survey. This slide will cover the area, the demographics, recreational location, transportation, safety, stores, businesses, and restaurants. The community of Fairburn is rural. Most of the homes in the community are newly built homes no more than 15 to 20 years old. They are single family homes with 2 or 3 levels. I found that the newer home subdivisions were well maintained, and this was mainly due to them having HOAs. The population of Fairburn is approximately a little over 15,000 and consists of 69% of African American, 15% Caucasians, 12% Hispanics, 2% Asians, 1% or 2 or more races, and 0.3% of American Indians, Native Hawaiian, and other Pacific Islanders. Fairburn doesn't have any organizations for the teen or the older generation to hang out or have a good time. However, they do have 3 recreational parks. Fairburn does have a bus line that runs within the community, but however, they do not have a train station. Most residents get around by their cars or truck or utilize Uber, Lyft, or a taxi cab. The community does have a police department. The crime rate is rather low. The 2 highest crimes that transpire within the community is burglaries and robberies. There are several stores that's located within the community, but majority of the stores is located within the city. However, Fairburn don't have any department stores nor a Walmart. Windshield survey continued. This slide will talk about schools, government, churches, communication, and the environment. Fairburn has a good number of schools that teaches from pre-K to the 12th grade. All schools has up-to-date technology as well as outdoor equipment and playground areas. There are 2 locations within Fairburn where individuals can go and get assistance with WIC, welfare, and social services. Fairburn do have a large amount of churches within the community. The largest number of churches consists of the domination of Baptists. However, there are more older churches than newer churches in the community. I didn't see many political signs in the community while I was doing this survey, and it could be because it's not election time. The air quality in Fairburn is clean. I didn't notice any smoke or pollution in the air while completing this survey. According to city data in 2016, the air quality in Fairburn is average at approximately 85.9%. Community assessment data generation. This slide will elaborate on health services, health coverage, primary care physician, leading cause of mortality, and non-compliance. The city of Fairburn currently do not have a local hospital, so if there's any resident that need immediate medical attention, they will have to drive 20 to 30 minutes to the local hospital. According to research, 85.3% of Fairburn residents have healthcare coverage. There are a vast array of medical clinics, dentists, ophthalmologists, urgent care clinics within Fairburn. According to Data USA, primary care physicians see approximately 1,500 patients a year, where dentists see almost 2,000 patients a year, and mental health providers see a little over 800 patients a year. I wasn't able to find the leading cause of mortality for residents of Fairburn. However, according to the Fulton County Board of Health, hepatitis, stroke, and obesity are the leading cause of mortality and morbidity within Fulton County, and Fairburn is a city of Fulton County. The number one issue that was noticed within the community was non-compliance with medication. Proposed intervention for community health plan, medication non-compliance. The lack of compliance to medication regimens within the community is what prompted the much needed intervention. According to research, 50% of individuals suffering from chronic illness condition maintain strict compliance to their medication regimen. However, the rates of non-compliance are substantially higher for individuals who suffer from various mental disorders, with estimates ranging as high as nearly 3/4 of patients with schizophrenia. Medication non-compliance can impact a patient's health outcomes and could lead to increased hospitalization, homelessness, substance use, decreased quality of life, and suicide. Proposed interventions for community health plan continue. Factors that may exacerbate non-compliance with medication. Some factors that may exacerbate non-compliance with medication may include patient-related, such as demographic factors, psychological, lack of insight into illness, negative emotion toward medication, social or environmental, therapeutic alliance with the physician, housing stability and support, and discharge planning, medication-related, complex dosing, schedules, medication compliance, tolerability, complexity, and cost. Patient understanding of medication indication and onset of therapeutic effect, and patient views of benefits can impact compliance. Develop community health diagnosis. Purpose of collaboration. There is a pressing need to develop and implement a community-wide intervention for Fairburn to reduce non-adherence rates with medication regimens. Promoting medication compliance among patients requires establishing partnerships as part of collaboration with members of the healthcare team. Devise community health plan, community partners, and community resources. One of the community partners that could play a critical role in this process is the community health workers, because of the roles they play in promoting health and well-being within the community. In addition to these community partners, community resources are also required towards successful collaboration with members of the healthcare team. One of these critical community resources that help enhance collaboration with healthcare team members is community health centers. Proposed evaluation methods for community health plan. Evaluation of interventions. The first stage of the community-wide intervention will be to identify the full scope and nature of the problem of non-adherence to medication regimen according to demographic factors throughout Fairburn using statistical sampling. By utilizing this benchmark data, the success of the intervention will be evaluated by follow-up surveying at 3-month intervals to assess the effectiveness of the existing intervention and to determine if changes or additions are needed. How evaluation goals might be met. Changing the goal and interviews. Modification of the goal might be a valuable strategy for accomplishing it. The importance of strict compliance to medication regimen means that alternative methods of better accomplishing the goal must be used. However, following up face-to-face interviews with community health care workers could provide valuable insights concerning how receptive patients were to the promotional information they were provided and what effect these had on their compliance rates with their medication regimen. Summary. Given the numerous negative healthcare outcomes that are associated with medication regimen noncompliance, it is clear that promoting awareness of the importance of taking medication as prescribed represents a cost-effective and timely community-wide intervention. Although the residents of Fairburn generally enjoy overall good health, it is reasonable to conclude that the problems that are caused by many of the chronic disorders that are common in this population could be mitigated through improved compliance to medication regimens. By educating the public and keeping this issue in the forefront of the public awareness, this intervention can help further improve the health of residents of Fairburn in the future. Attached are the references. Thank you for listening to the PowerPoint